and head on out to our special guest from OrthoVirginia, Dr. Nicholas Erdle. Did I pronounce that right, Doctor?
You did. Thanks for having me.
Of course. Thank you so much for joining us on this morning. Want to start here. Read that you decided to go into orthopedics because of your time as a student athlete here in high school, in high school here in Richmond. How did those relationships help push you towards this career field?
Good question. So I went to St. Christopher's High School here in Richmond. I played a few sports. I played soccer, lacrosse, and cross country. And over the course of my middle school and high school years, had a few injuries and got to know Dr. Chris Young really well, who's an orthopedic surgeon here, recently retired, and his son was a friend of mine, and he ended up being somebody who treated me and who, as I got older, I started to shadow in the operating room and ask about this career path. He had gone through the military himself, so he was a good mentor for me as I considered the Navy as an option, and really had a lot of respect for him as a mentor, and that's how I made that decision.
That's awesome. And now you work specifically with shoulders and knees. And when I saw that, I was like, those do kind of seem two similar things. How are those two similar?
They're similar in some ways, obviously different in a lot of ways. They're similar in that they're frequently injured in sports injuries, that they can be plagued with instability or torn tendons. They're important for our day-to-day quality of life and athletic functions. They're also interesting in that they can both be treated arthroscopically or minimally invasively from a surgical standpoint, where we use a camera and instruments to fix things in a more minimally invasive way. And then ultimately, in the setting of end-stage arthritis, they can be treated very well and very effectively with replacement.
That's awesome. Kind of taking a look at sports itself, I would love to know, because we hear so much now about specialization in sports, kids working on, one specific sport at a young age and kind of doing that, whether it's baseball, football, soccer, and not really having that sport. I mean, just getting different experiences across different sports. What's your take on kids specializing in one sport at an early age?
That's a great question. And, I think particularly before skeletal maturity, which for boys is going to be around 15 to 16, and for girls a little bit earlier than that, 14 to 15. Specializing in one sport comes with a risk of overuse injuries. And also in terms of being a well-rounded athlete, we would encourage children at younger ages to play multiple sports. And part of the benefit of that is sports can complement each other and it can develop unique skills. And another important part of that is it gives the body important time to rest and recover from long seasons. And I'm not alone in feeling this way. We have a couple of big orthopedic organizations, the American Academy of Orthopedic Surgeons and American Orthopedic Surgery Sports Medicine societies, which both recommend that in kids under the age of 14 or 15, that they not spend 12 months a year playing a single sport, and because of the risk of overuse injuries. So they'll recommend no more training per week than the age of the child. So if that's a 12-year-old child, that's 12 hours a week, taking a couple days off every week, and then taking at least 2 or 3 months off a year, not completely from athletics, but potentially from the single sport to try a different sport. As kids get older, that's harder, and I understand there are sports, and I've talked with a colleague about this weekend, actually, who is a competitive Division I swimmer. When you get to the more competitive levels and older, it's hard to take that time off from a sport and feel like you're not losing something, but particularly in youth athletics, we strongly encourage taking a season off and consider playing another sport.
Yeah, I think everyone you just mentioned agrees with that. I think a lot of professional athletes also are starting to agree with it. I think Jason Kelsey was on the set of Thursday Night Football the other day petitioning that players and kids need more, one, because of what it's doing to the body, but also because what you may learn in baseball may transition over to football and vice versa. So yeah, starting to see that kind of pick up some steam. I would love to know, as we go from, we're in what we call in the media industry affectionately crossover season. It's when football is going into basketball and things are getting a little crazy. We're going from fall into winter. What injuries, sports injuries specifically, do you see most during the fall season? And I imagine it probably differs a little bit as you go into the winter season more with maybe basketball happening in high schools?
Absolutely. Yeah, there are some injuries that are sort of unique to certain sports and others that we see in a lot of different sports. Obviously, whether it's soccer, football, basketball, we're seeing a whole lot of ankle injuries just because of the nature of those sports, whether it's ankle fractures, ankle sprains, high ankle sprains, knee injuries, ACL injuries, not unique to specific sports, but certainly more common in our pivoting sports. Sports like basketball, we are seeing, or we do tend to see more of the injuries that we see in jumpers. So things like jumper's knee, tendon issues, tendon ruptures around the knee and around the ankle.
What sport, just out of pure morbid curiosity, what sport typically has the worst injuries?
So, I don't think this will surprise you. Football is a sport where there's just a lot of fast-moving, large players, and that's a sport where we tend to see, injuries like concussions, injuries like fractures, injuries like we saw over this last weekend that are, result of those short bursts of play with high energy and high contact. That said, we can see some devastating injuries in sports like gymnastics as well. We can see devastating injuries in sports like horseback riding. So no sport is immune. And even in sort of endurance sports, we can see things like stress fractures, which can progress and really affect a season or affect an athlete for a long time. So it's important to sort of know what injuries athletes are susceptible with different sports, but certainly football is a rough one.
Yeah, that's kind of what I expected, but just pure morbid curiosity with that one. And you kind of alluded to one of the players we saw with a pretty bad injury over the weekend, Jaden Daniels with a dislocated elbow. And I know you don't work specifically with the Commanders with Jaden Daniels, just offering expertise here. Because early on in the season, he picks up an MCL sprain. Then a couple weeks later, it's a hamstring. Now it's an elbow. And all of them are different. They're not the same muscle group. They're not the same exact thing. But when you see one injury get picked up by an athlete, do you typically then see if that one isn't handled correctly, the injuries start to mount up?
I think it would be a stretch to say that those are related. Although, from the perspective of being a fan, I think there's certainly, concerns, and I think, as to why he may have still been in the game. And I'm not going to question any decision making like that, but I don't think they're related. To give you the short answer, I think that this was, a bad fall on an outstretched hand where the elbow saw more force than it was able to withstand, and I don't think the knee or the hamstring injuries directly were related to that.
And another injury that popped up over the weekend, and again, you're not working with these players, just offering the expertise. Joe Flacco, I think 42-year-old quarterback now, he was dealing with a sprained AC joint, and there was a lot of in his throwing shoulder, and there's a lot of questions of whether or not he was going to be able to play through that pain. Can you explain what a sprained AC joint is and how that may impact a quarterback throwing a football?
Absolutely. So a sprained AC joint is a very general term for a very broad spectrum of injuries. A sprained AC joint can look stone cold normal on X-ray, and can just be a minor tear of some of the ligaments in the capsule that connect the acromion, which is part of the shoulder blade, to the collarbone, which is the clavicle. Those can be very uncomfortable. They can cause pain with overhead activities, namely in a throwing shoulder that's throwing the football. On the more extreme side of AC joint injuries, we can see AC separations where all of the ligaments that connect the collarbone to the shoulder blade are injured, and those sometimes require surgical fixation. So not knowing the extent of Joe Flacco's injury, I'm sure that his docs and his medical staff are on top of it. It's an injury that we can sometimes, treat symptomatically, and that the players are able to play through for the season and may need to be addressed later, or may heal on its own.
And we've talked a lot about injuries through this morning. I would love to know any prevention tips you have, injury prevention tips, things of that sort that you can share with high school athletes in general, parents, things of that sort.
Good question. So, all sports, come with risk, but we can train responsibly, and our coaches can, sort of responsibly manage players. And I think in this day and age, coaches and parents are becoming increasingly aware of that, which is a great thing. Circling back to one of those first questions you asked me about, focusing on a single sport in a skeletally immature or a young youth athlete increases the risk of overuse injuries. So taking time off and taking seasons off can help prevent injuries from that standpoint. From acute injury standpoint, gradually increasing impact activities and endurance training and things like runners and swimmers can produce flares and overuse injuries that we see at the beginning of the season when young athletes are trying to catch up or train too quickly or train too hard. And then ultimately, warm-ups and listening to the body and not playing through pain can be important to sort of stay ahead of injuries before they become more chronic and linger.
Gotcha. That's awesome. Where can listeners go to schedule an appointment with you all at OrthoVirginia if they have any sports injuries?
The best and easiest way is OrthoVirginia.com. There's a big bright red button that you can click. You can search for us by name or by body part or by specialty, and OrthoVirginia.com.
Awesome. Dr. Erdle, thank you so much for the time. Have a wonderful rest of your Wednesday. Appreciate all the insights on this great morning.
Thank you for having me. I really appreciate it.